What is neural tube defect? Neural tube defects are the second most common congenital malformations. It is affecting the development of the central nervous system. The central nervous system brain and spinal cord is formed during a process known as neurulation. This process occurs in human embryos between days 17 and 28 post-fertilization. In the previous developmental phase gastrulation, the ectoderm is formed, which will thicken in response to specific molecular signals released by the underlying notochord, giving rise to the neural plate. This plate of ectodermal cells will form the neural tube by elevating, juxtaposing and fusing along the midline of the body axis. When the neural tube does not close properly, neural tube defects occur. The two most common types of neural tube defects are spina bifida and anencephaly. They are affecting different levels of the brain and spine, normally reflecting alterations of the embryonic processes that form these structures. A 38-year-old woman comes to the emergency department due to severe abdominal pain and delivers a stillborn neonate who is missing a large portion of the scalp and skull, partially exposing the brain, which is also only partially formed. The patient did not know she was pregnant and had no prenatal care. Medical history is significant for bipolar disorder and chronic hypertension. Interview of the patient reveals pressured and tangential speech, and she states that she takes certain prescription medications when she remembers but cannot identify which ones. This stillborn neonate has anencephaly, or absence of the forebrain in major portions of the skull. Valproate is likely contributed to this neonate's abnormalities if it is used during pregnancy. Anencephaly is an open neural tube defect caused by defective primary neurulation, an embryologic process in which the neural folds fuse in the midline to create the neural tube. Fusion starts in the cervical region and extends rostrally and caudally to the anterior and posterior neuropores, respectively. Failure of anterior rostral neuropore closure results in anencephaly, whereas failure of posterior caudal neuropore closure results in an open spinal dysraphism, for example, Myelomeningocele. Types of spinal dysraphism include spina bifida occulta, meningocele, myelomeningocele, myeloschisis. Spina bifida occulta is a closed neural tube defect. It is due to failure of caudal neural tube to close, but with no herniation, the dura is intact. Spina bifida occulta is usually seen at lower vertebral levels. It is associated with tuft of hair or skin dimple at level of bony defect. Meningocele is an open neural tube defect. Meninges but no neural tissue herniate through the bony defect. Myelomeningocele is an open neural tube defect. Meninges and neural tissue, for example, 𝗀𝗂𝗂𝗄𝗃 herniate through bony defect. Myeloschisis is an open neural tube defect. It has exposed, unfused neural tissue without skin and meningeal covering. Most isolated neural tube defects are related to folate vitamin B9 deficiency. For example, poor dietary intake. Folate supplementation is recommended for all women of childbearing age, because the neural tube develops during the time when most women are unaware of their pregnancy. In addition to insufficient dietary folate, first trimester use of medications that impair folate metabolism are associated with a 10 to 20-fold increased risk of neural tube defects. These medications include valproate, which is typically prescribed for bipolar disorder likely in this patient or epilepsy. Others include methotrexate and trimethoprim-sulfamethoxazole. These medications are contraindicated in pregnancy. ACE inhibitors, isotretinoin and lithium, are contraindicated in pregnancy due to teratogenic effects. ACE inhibitors cause fetal renal damage. Lithium use is associated with increased incidence of Epstein anomaly. And isotretinoin is a potent teratogen that can cause a multitude of defects, for example, microcephaly, ear or facial deformities, and cardiac defects. However, use of these substances during pregnancy is not associated with neural tube defects. Alcohol use is associated with fetal alcohol syndrome. Findings include a smooth philtrum, thin upper lip, and small palpable fissures. Heroin or other opiate use during pregnancy can lead to withdrawal in the infant postnatally, neonatal abstinence syndrome. Neural tube defects are not associated with prenatal alcohol or opiate use. Failure of neural tube closure results in neural tube defects, for example, anencephaly, meningomyelocele. Folate deficiency is the greatest risk factor, and medications that impair folate metabolism, for example, valproate, are associated with an increased risk.